Hi everyone, welcome to Nick Barlow Radiology. I've decided to come out of the office today because it's absolutely sweltering. For those of you out in the UK, we're in the middle of a heat wave at the moment. It has started being a bit blustery, thankfully, so my hair's going to be blowing all over the shop, so apologies for that, but at least it's a bit of breeze. I thought I'd come out here with a nice cup of tea and do this latest video. So this is in response to some questions I've had about reporting and people who are interested in reporting but don't really know how to prepare for it, don't really know how the training works. So I thought I'd do this video just to explain how I got into reporting and just some tips really on what you should do to be prepared for when any interviews come along, if it's what you want to do. So the first question that I get asked is, how long should I wait before applying? In the good old days, it always used to be 2 years in radiography before you could go on to do anything. So you do 2 years in plain film, and then you could go on to CT, MR, reporting, whatever. Times are a little bit different now, and there's more of a recognition that it's dependent on the person's own skill set. Time in the job doesn't really mean an awful lot. It depends on what you're like as a person, and in this job there is a lot of multidisciplinary communication. Now, some of that you can build over time through experience in working as a band 5 or band 6 radiographer, so I kind of get where the 2 years comes from that. But we've seen a lot of more mature students coming through, people that have had jobs previously that might already have those skills. Even people that have come straight from college to uni, they may have had other jobs there to earn some money to get them through the course, and they may have already picked up those skills. So I think it's important to have, personally, I would say at least 6 months to a year, because it's not only for reporting, you're going to be an expert in plain film, and you're often going to have to go there and help some of the younger, more inexperienced radiographers do certain difficult X-ray scans, X-ray images, to be able to see what you need to see. So you need to have that experience to be able to go in and advise them, and you only get that over time. I think sometimes people forget that, you think reporting and you just think about the reporting, but actually there's lots of other elements to the job, and clinical's still a part of that. You still need to be X-raying. So I would say probably 6 months to a year minimum, really. For me personally, it was 2 years, and I felt just about confident after those 2 years to be able to deal with the communication side of things and build up my expertise in plain film. A lot of it will also be circumstantial, so there may be a job come up in a year. You may feel like, ideally, I've wanted to wait another 6 months. But if that job's come up, you might think, do you know what, I'll do the interview. If I don't get it, it's good experience, and that's fine as well. You've got to respond to when these things come up, because you don't know when the next one's going to come up. So it's always worth giving it a go. And worst case scenario, you don't get the job, but you've learned a lot from the process, and that's important as well. The next question I get asked quite a bit is, what should I do first? So should you do MSK reporting or chest and abdomen reporting? Now, where I worked, they needed a chest reporter, and I was lucky enough to be accepted onto that. So I did the chest and abdomen first. Most places would do MSK first, but it depends on the hospital. It depends what they need, really. So if they specifically need a chest reporter, then they'll put that job out, and that'll be what you do. I don't think there's any difference really in terms of difficulty. They're two completely different disciplines, different pathologies, different things to learn, but I would say chest is more subjective and requires a bit more of an investigation kind of approach. But you could equally say the same about bone tumours, for instance. So I don't think it matters. I think it's going to be dependent on what that hospital wants, and I wouldn't worry if it's chest and abdomen first. You'll be absolutely fine doing it that way around. It made absolutely no difference to me whatsoever. How long will I need to train? So each module is 6 months, 2 modules in the postgraduate certificate, another 2 modules in the postgraduate diploma, and then another year's masters on top of that if you choose to do a masters or you're supported to do a masters by your trust. So the actual reporting element, for me, I'm not sure if it's changed now, but for me it was 6 months. And then you had another module in leadership, advanced practice stats to bulk it out. All important, but the actual specific reporting element was 6 months. So as I say, a year for your postgraduate certificate, and then if you then go on to do the other reporting module as part of the postgraduate diploma, it'll be another year. So doing it from start to finish, if you do the full thing through to finishing your masters, you're looking at a minimum of 3 years. And then if you want to do a PhD, even longer, but go for it if that's what you want to do. So how do I prepare for an interview? It's very difficult because, and we'll go on to questions later, but obviously the questions are going to be completely dependent on who's asking. So, but I can give you some rough guidelines because I used to interview for reporting jobs quite regularly, and some similar questions do come up. In terms of your CPD and preparing for interview, you know, I used to hate it when someone would come up to me 2 weeks before the interview and say, oh, yeah, I might be quite interested in that. And they've not done anything. They've not done any background preparation, not done any reading, not done anything whatsoever. And it's very, very reactive. And in this game, you've got to be proactive rather than reactive, okay? So interviewers are wanting to see that you really want to do this job. It's not the kind of job you can do if you only want to do it for a pay increase, for instance. You've got to want to do the job. It's very, very hard, very, very rewarding, but very, very hard, okay? So whoever's interviewing needs to know that you're committed and that you'll see the course through to the end, and you'll be able to be an effective member of the reporting team. And that requires learning a lot of things and a lot of skills. So by showing to them that you're proactive and you're willing to put the hard yards in before the interview, that goes a long, long way before you've even sat down in that interview chair to face that panel. So I guess I've got some little notes here that I've written down from stuff that I used to do, and the first one is pretty obvious. You really could do with sitting in with reporting radiographers, consultant radiologists, to sort of to gather some very basic knowledge of reporting, but also to look at things like their reporting style. You know, how do they phrase the reports? What terminology do they use? Do they change them depending on whether they're reporting for a GP or an A&E clinician, for instance? So it gives you a little bit of knowledge and exposure to that. And it also gives you an insight into their day. You know, are they interrupted all the time? Do they answer phone calls? Do they do hot reporting? Do they do radiographer-led discharge? Are they always called away for meetings? You know, what is their typical day like? And you kind of get a tiny little snapshot of that by being able to sit in with them and seeing how it works. You need to read around the job. Okay, so as I said before, reporting, it's not just reporting, there's a clinical side, but depending on whether you go into advanced practice or enhanced practice, you've got to look at the whole picture, okay? So we talk about it in terms of the 4 pillars of practice: research, education, you've got the clinical side of things. All this kind of thing comes together, and if you just focus on the reporting and you don't acknowledge the rest of the job, that shows that you don't have a clear understanding of what that role entails. So I would go and look at Health Education England's framework for advanced practice. So I've got a multi-professional framework for advanced practice that they've just released 2025. They've updated it. Go and have a look at that. And that splits down the 4 pillars and exactly what's involved, what's expected. And there's a big element of leadership in that. Have a look at the Society of Radiographers education and career framework online. So they break it down into practitioner, enhanced, advanced and consultant, and exactly what each of those roles involve. And you need to be talking to people within the trust, the current reporting radiographers, the managers, to find out exactly what is expected. You know, are you expected just to do, say, MSK PG cert and then just report MSK and do enhanced as an enhanced practitioner, or are you expected to do chest, abdomen and MSK, do the masters and be an advanced practitioner? Because they're two quite different things. So it's worth just having a conversation early doors to know exactly what's going to be expected of you, and knowing exactly what those jobs entail will really help you. So that would be my advice: to go online, Look up those two documents and know exactly what's meant by enhanced and advanced practice and what's going to be expected of you in your job role that you're applying for, because it's not just for reporting. You can read articles on X-ray interpretation, so there's some good articles on Insight, so I'm on the editorial board for Insight and see lots of good reporting articles coming through there with showcasing different pathologies with some reporting tips. That's really good. There are online courses as well, some of them better than others. I wouldn't advise spending a fortune on them, okay, but there are some good courses out there with some not too over the top, not too difficult. It's pitched at just the right level for people who are going into reporting, so just have a look out there and see what's out there. If you Google it, there's lots of different courses. There are some online platforms as well that do red dotting, commenting. Obviously there's my channel that gives you free content on X-ray interpretation. Obviously my videos are shorter, but it's still good CPD for you. And there's some good books as well. You can I mean, again, that some of these books are quite expensive, but there are lots of very, very good plain film reporting books out there. Have a look online, see what works. A personal favourite of mine is Arthritis in Black and White. That's really good. But obviously I'm not sponsored to say any of these books, but yeah, there's lots of good ones, so go and have a look, see what you like, see if they've got any in the trust. Maybe you could borrow one. Maybe there's some sort of older books, because the principles never change in reporting, so there might be some older books in the trust. See if you can borrow one and just have a little bit of a read around. Ask if you can help with audits, so there should be audits going on. We're all required to participate in audit as part of HCPC standards, so there should be audits going on in the trust, and again, falling under the research pillar of advanced practice, it's important that you participate in audit and research, so have a look and see what audits are going on, see if you can get involved. If you've got a research radiographer or a research team, speak to them, see if there's any projects that you can get involved with, can help with. You might even have a research group. Some hospitals will have a research group that meets once a month to discuss articles and projects. See if you can go along, get involved in that. Again, it's recognising that additional pillar of practice and showing that you're contributing to that, not just for reporting. See if you've got a consultant radiographer or if you've got a senior reporting radiographer, see if you can shadow them for the day. See if you can come along and be an observer to meetings such as the Realm meeting. Radiographer education and learning meetings, so they're the meetings where you discuss discrepancy cases, good learning cases, and good spots as well. So they're really good to get an insight of how discrepancies are discussed and dealt with. And it should be a nice learning environment. It shouldn't be judgmental. It should be relaxed. It should be a place where you can learn, rather than a place where you can be criticised, as some probably were previously. So, in addition to that, some hospitals also have advanced practice or advanced practitioner meetings where people will go and discuss the advanced practice framework. You know, where are we in the trust as regards to that? Should we be improving things in terms of scope of practice, role extension? They might even look at things like pay as well for that. So if you can go and observe one of them meetings, again, it's looking at contributing to things outside of just your department. It's looking at the wider impact on the trust. See if you can attend a conference. So there's lots of conferences out there. I would say probably UKIO is the main one. UK Imaging and Oncology Conference meet once a year, usually in Liverpool. It's been in Liverpool for donkey's years, and I don't think that's going to change. So we've just had that. It's usually around June time, early June time, and it's usually over Monday, Tuesday, and half a day Wednesday, 3/4 of a day. Go along to that. There's lots of really useful lectures that you can go and watch. People do poster presentations, they'll do short 8-minute presentations, oral presentations on research projects that they've done in their trust, and it's a good way to network with people as well. And you can see the new technologies out there, you can see different reporting companies if you're interested in ever going into outsourcing. And you can chat with colleagues from different trusts and see how they approach reporting and their scope of practice and what they do. So UKIO is very good. There's also the LT RAP, which is leading the way for radiographer advanced practice. So that's a conference it's an international conference. So it's a conference for advanced practice, not just reporting, but you get radiographers coming from all over the world to this conference. It's been in Singapore before, Toronto, but it's in Bradford this year. So it's in Bradford the 5th to 7th of September. So if that's something you'd be interested in, have a look online, LTWRAP, Bradford. If you Google that, then you'll see it's run by a colleague of mine, friend of mine, James Harkis. He's really brought a really good programme together with some really good speakers. Really interesting. So I'll be going along to that and hopefully see you there. And yeah, there's also free study day. So what was NHS England ran a really good study day on AI, which was free. AI for reporting radiographers in York. That was really good, really well received, and there'll be more of those free study days throughout the year, so do look into those. And there's also a really good reporting special interest group. Now this is run by two ladies called Helen Watts and Selena Watson, and they are based up in the northwest, and they started it as a special interest group for radiographers based in the northwest, but it's grown into more of a national special interest group through the Society of Radiographers. So it's an accredited special interest group, and it's fabulous. It's completely free to attend. They do lectures on all sorts of things to do reporting. One of them was on radiographer-led discharge, one was a case study. They do all sorts, and that's a really good learning environment. Really good to get involved with at this stage, because nothing is overcomplicated. Again, gives a good chance to network as well. There's a lot of radiographers now that are taking part in that, and you can get in touch with some of those and have conversations. So I would recommend that if you look on the Society's website, there'll be contact details for Helen and Selena there, but have a look at the reporting SIG. It's very good. So all of those things are just ideas, but it gives you a sense of the fact that there's so many different elements to the job. There's so many different things you can do to prepare for the interview. Don't just come and say, I'd like to do it. Okay, so use your time to be able to do all of these things. Even if you do maybe 5 of them, it shows you've got a good understanding of what the job entails and you're willing to put the work in. So yeah, go and do that. So with regards to the interview questions, I guess it's, like I say, it's really difficult because everyone will ask different questions, okay? You would expect there to be some kind of commenting exam there, because we obviously want to see your experience in terms of being able to spot abnormalities on X-ray. Often they'll ask, to talk about yourself, showcase yourself, your experiences, what have you learnt already. And I always find, it's really good to reflect. I always kind of think of, when I'm thinking of potential questions that people may ask me at interview, and I've done a fair few interviews in the past, both sat in and given, I always find it good to give an example. So if someone said to you, tell us about yourself, and you said, I think I'm a really good communicator because I had to deal with this really difficult patient who was kicking off in the waiting room, and actually brought them to one side. I sat them down away from everybody else and took time to explain what was going on and etc. That shows that you're not just answering the question for the sake of answering it. You're actually giving concrete evidence to back up what you're saying. So there's no good just saying, I'm a really good communicator, I'm a good timekeeper, I'm hardworking, and I'm professional. That's great, but how? What have you done to prove that to us? So if you can find some examples and reflect on them, that's brilliant. And that kind of ties in with university postgraduate learning, that is constant reflection. You're constantly having to back up your ideas, your thoughts. This all ties in. This is what people are looking for. There may be a scenario question, so you've got a difficult clinician that's questioning your report, what do you do, things like that. You see a tension pneumothorax, what do you do, how do you flag it up, how do you use urgent codes, alerts. So again, by sitting in with someone, you'll be able to see how those are used, and you'll be able to reference that and say, well actually yes, I sat in with so and so for the day and I saw them use alert codes here, so that this is what I would do. Again, it's just evidence to back up your points. Tell us about advanced practice. That's one. So again, that links back to your 4 pillars of practice. So you, again, by reading around that, by reading those frameworks, you'll be able to answer that question quite easily. Break it down into the 4 pillars of practice: leadership, education, research, and your clinical side. I think discrepancies are also a big part of it. So often people will say, you know, you get a discrepancy on an abdomen x-ray, which may have affected that patient's management. How do you deal with it? Sorry about the cars. How do you deal with it? So it's about reflection and learning. It's about going away, reading around the subject, taking your time to learn from the mistake. It's not taking it too personally, but it's recognising it as a learning opportunity, and hopefully by reading around it, maybe doing a reflective article on it, maybe reading around it and then doing an article for insight on it, or speaking with colleagues to see maybe how they would have interpreted and phrased it. That shows that you're willing to learn from your mistakes, that you won't make that same mistake again, but also that you're not going to go away and be tossing and turning in bed at night thinking about it for the next few months, because you can't really do that. You've got to take it for what it is. It's unfortunate. No one likes discrepancies, but unfortunately they are a part of this job. Everybody will get discrepancies at some point, so it's how you learn from them, and the interviewers need to see that you can deal with those. So the only other thing that I always used to ask is, where do you see yourself in 5 years' time? And I ask this because I think it's useful, I think it's interesting to see where people want to go with it, and you get different answers from everybody. You know, are you content with just staying as a enhanced practitioner reporter? Would you want to go on and complete your masters and do advanced practice? Would you want to do a PhD? Would you want to be a consultant radiographer? Would you want to help develop a service into radiographer-led discharge or something like that? There are lots of different things you can say, and everybody has different aspirations, different motivations, so I just find that that's quite an interesting one to do, just to gauge the mindset of the person that's being interviewed. So something like that could crop up as well. So think about, you know, what are your motivations? What's driving you? Why do you want this job? Is it to make a difference to the patients? Is it the interesting pathologies that come up, and the chance that you know, the fact that you're constantly learning, the chance to continuously develop yourself and in your own experience? Is it to lead on to another career, as in, you know, consultant radiography, or into more sort of senior leadership roles? There's no right or wrong answer, but it might be good for you just to reflect on where you want to be in 5 years' time. And then you can start planning. So you could say, you know, short term, medium term, long term goals. Short term, I want to do the course. Medium term, I want to become established. I want to ground my knowledge, build on that foundation of knowledge, and really build up my experience in reporting and build my communication skills. And then longer term, progress into consultancy or develop a service, or, you know, what can I bring to the team? What different things can I bring to this service, so that when you leave you could say, actually, yes, I've shaped this, I've made a difference here. So those are my tips. As I say, there'll be other questions that crop up, but I don't think they'd be far off with those. Those kind of topics come up quite regularly. So enormous luck. If you have any questions about getting into reporting, just drop them in the comments. Or contact me directly, it's absolutely fine. I am going to do a video on pros and cons of being a reporting radiographer at some point. And also look out, because we're going to do some really good videos with one of my past lecturers, Michelle Elwood at Leeds University. We're going to be working in conjunction to do some videos for students on radiographer career opportunities, not just in reporting but in other areas as well. So those are going to be aimed mainly at students, but radiographers going to be interested in those as well, so do keep an eye out for them. If you've liked this video, please subscribe to the channel, drop us a like and share with your colleagues so that they can watch some further videos. But for now, thank you everyone for listening, guys, and yeah, see you soon. Bye for now.